So now what we're going to do is tandem stance. So that's kind of like doing the police drunk test, where you're just going to put toe to heel, heel to toe. So you're just going to stand, just like with the narrow stance or the Romberg stance, you can do the same things. So we have the same sequence we can employ. We can stand normal like this with our arms crossed to challenge our balance. We can close our eyes to challenge the balance a little more. Even I start to drift off there. So yeah, I should be doing more balance training as we get older. You can add head turns, head nods, the same sequence of challenges that we did with the narrow stance you can do here. If it's too difficult and you're finding too much difficulty standing like this, overlap the feet. Let them touch, but have what we call a narrow stance, but not heel to toe, just overlap them a little bit. And that'll make you a little wider on that base of support and only minimally increase the difficulty that way. Okay? So the other thing that we can do is dynamic walking as well. Just, this is the check stop test idea, is the heel to toe walking. So walking heel to toe. And again, if it's too difficult to go heel to toe, you can go slightly to the side or just a narrow stance. So we're going to walk heel to toe anywhere from 10 to 20 feet like we were doing before, walking forward. If that's really easy and not much challenge, you can reverse that, but only if you're stable. Oftentimes when I give this, I will pick a narrow hallway where someone has walls to support themselves. So you can hold against the walls if you need to. Here is windows. I don't like using windows as a support because obviously glass, if you fall, you already have a risk of falling uncontrolled. Through glass means more complication. So I'd rather have a wall, close to a wall, to do that. Heel to toe walking. Okay. So heel raises, another thing for strengthening. When we want to strengthen legs, we want the front of the legs, the back of the legs, which we've done. Now we want to get the calves as well. So you can do heel raises. You can do both legs at the same time, which is an excellent exercise. Or we can make it a little more challenge, a little more strengthening by doing one leg at a time. So if you need to, you can hold onto the wall for this, or you can work balance and control. The one thing when you're doing heel raises, it's really, what I really like to do is go up and then really slow on the down. Up and really slow on the down. So up, normal speed, down, slow. Okay, so after we've done heel raises, we can now go into single leg standing, which is very challenging. So if you're worried about balance, you really want to be in a corner for this one, or have a stable surface towards you or somewhere soft, because you really don't want to fall, and I don't want you to fall. So making sure you're safe to do this. If you have a wall, you need to hold on to the wall, you can. But when you're standing single leg, you're not going to prop the other leg on. I want you to just bring it forward and let your leg relax. Close your arms. Challenge this can be challenged the same as all the other standing exercises. You can close your eyes. You can do head turns, head nods, and you can challenge the surface again. Just like before, we have the different surfaces. You have a cushion at home, something that's not going to slide. These are nice because if you put them on the ground, they stay. They don't slide around. So being careful with cushions that they don't and won't slide. So you can do the same thing. We can take a single leg stance on the cushion. And that's a lot of challenge there. Then we can close our eyes and really work. Again, eyes closed is for a really final challenge. That's a very, very difficult thing to do. These saucers, well, that was loud. They offer another challenge. That's a lot more difficult because there's a lot of play on those. So we can do things with these where we're working our muscles later on. For the athletes, they do a lot of single leg stuff, building strength and balance at the same time. Okay, the final thing of the balance before we do the ear exercises and the eye exercises is just working on high stepping. So finally, we're going to do high stepping with arm swings. Just like you did before, walking in place, this time getting arms to come up in place. High steps really strengthen and get that range of motion going. Okay, another thing you can do is if you take TheraBand, tubing or the band, you can hook it onto a doorknob and you can start challenging balance by, for example, standing on one leg and pulling the band It's just tied to a chair, so I'm not going to pull very hard because this is not appropriate. I don't have a doorknob close by, but you would just do exercises where you're pulling backwards while standing, or pulling backwards while bringing opposite, or switch the arms around if it's more comfortable. Okay, that's another way of adding some challenge. Okay, so the next set of exercises, we're going to start with sitting. Again, balance exercises can be done sitting starting as well. If you have an exercise ball at home, just sitting and getting balance and doing circles, weight shifts is a good way. Leaning in and out is another way of starting balance exercises. The general progression when we're doing exercises, especially when we start dealing with the inner ear kind of and eye exercises, is to start in a stable, most stable position, which would be sitting. Then progress that position as you get challenged a little better, a little better, a little better. We progress it by going from sitting, for example, to standing on a steady or firm surface. Then you can challenge that by going to standing on a not firm surface, like on the foam pads and that sort of thing, and then on a movement surface. And then you can do a lot of these exercises while walking as well as a final progression of these. So things like head turns while walking are very difficult to do, and it's a dynamic balance exercise that incorporates the middle ears, or the inner ears, I'm sorry, and the ankle balance strategies as well. Okay, so the first one that I'm going to do is called the Vor Suppression or Vor cancellation exercise. This is an exercise that kind of works that we have a reflex between the ears and the eyes that we're going to kind of work on. So all of our inner ear exercises are going to be aimed at that. Easiest way of doing this is taking your hands and holding them together, thumbs out together, and you're just going to rotate your body, watching your thumbs. Your whole upper body is going to turn with it, and watching the thumbs about 30 degrees. And again, this is 1 to 2 hertz, but depending on how you're feeling, you can, and I often will slow it down initially with patients, going more slow while they're watching their thumbs. Again, 30 seconds to 1 to 2 minutes at maximum. You're going to, if you develop symptoms, you're going to wait until your symptoms abate before you resume this exercise. So it's again a difficult one to find your tolerance. So we have to find what your tolerance is. That's why you should be working with someone with some of these exercises. It helps to determine how much you can tolerate and how to progress. But as a general rule, if you start feeling fatigue, nauseous, dizzy, or increased symptoms after, say, 30 seconds, cut it in half. And that's your safety zone. So you start at 15 seconds and slowly every few days add 1 or 2 seconds on there, but making sure that your symptoms do decrease, building up your times to 1 to 2 minutes, and then you make more, there's other ways of making them more challenging. So that's the VOR cancellation. There's another exercise that we call VOR exercise, where your head is turning and you're focusing on a dot. So I generally want your head for all of these ones to be slightly flexed about 20 degrees. You're going to be focused on a dot in front of you, could be about eye distance, so a couple feet in front. The dot is usually, I use a dot on a sticky, so this is it, and it's about 1 centimeter. This one's drawn a little big, but you generally want to do 1 centimeter. I can put the dot on the wall. I can turn and face the dot. So that's a little high for me, so I'm going to drop it down so my head is slightly down, slightly flexed in that little knotted position. From here, I'm going to watch the dot and I'm going to turn again 1 to 2 hertz. So about 30 degrees each direction, rotating. The same rule, again, as far as repetitions go. You can do 3 sets of, I generally start 30 seconds to a minute, 3 seconds, 30 seconds to a minute, but it all depends on symptoms. It might even be 15 seconds sometimes. And we wait for symptoms to settle down before we do the next set. Now, another exercise is called pencil push-ups. This works the eyes and it really strengthens the eyes, so it's kind of an ocular exercise. What you're going to do is start roughly about arm's distance, looking at a pencil. Sometimes we put a little pin on the, the sewing pin with the big bulb on the end, in the end of a soft rubber pencil. For this purpose, I have a 0.05 on top of my pen here. I'm going to use that. I'm going to focus on that. I'm going to bring that straight in towards my nose until I see double vision. If I start to get double vision, that's where I stop and then I slowly come out. If I don't get see double vision, I should, for me, this is an exercise I should be doing because I'm way out here. I'm well over 6 inches before I get double vision. Normal distance from nose to pencil before double vision is about 4 inches. If you're beyond that, then you need to do this exercise and work. I have a lazy eye, so I need to work on that. There you go. So for all of these exercises, the same kind of information. You can do these about, for that I can do 10 to 20 or 30 times. Usually I time things about 30 seconds for these exercises. I'll let symptoms calm down again. Okay. So for this next few, we've already done these in the balance exercises. So the next one that I would do here is tandem walk, walking heel to toe. And also slow motion walking, so working slow motion and walking. Then there's also just simply, as you're walking slow, but you can also walk backwards, focusing on toe landing, drop down to heel, working that slow motion process coming backwards. So those ones we've already talked about in the other balance talk, so we're going to kind of omit those ones right now. The last one for the vestibulars that I said that's really more challenging is the walking with head turns. So what you're going to do is have somewhere that's about 20 feet as a guideline. That's usually what I like. Every 2 or 3 feet, your head is going to turn one way, or every 2 or 3 steps, your head will turn, and then at about 3 steps, it'll turn back the other way while walking. For the purpose of this demonstration, I don't have a lot of room here, so I'm just going to do one head turn so you can see. So I would go 1, 2, 3, turn, and then come back to the right. So again, every couple feet, every 2 to 3 feet, your head will turn one direction or another for a total of about 20 feet. You do the same thing with nods. So every few feet, your head can look down, and then 3 steps later, your head will come up. Trying to walk as normal as possible with a normal speed and cadence, but just moving your head up and down or left and right. So I've already talked about the pencil push-ups for the eye exercises. Now a couple other exercises for the eyes would be what we call saccades. So it's the same idea. Instead of having 1 dot in front of me, I now have 2 dots on the wall at about 30 degrees apart. My head is slightly tilted. I'm not going to turn my head to look at the dots. I'm going to keep my head fixated, straight forward, but only turn my eyes. I'm going to go from the dot on my left to the dot on my right, back and forth. And again, we're going to just move the eyes, trying to get them to move smoothly without going too far. If I feel like I'm a little far back, a couple feet is really where you want to be from the wall. So I'm going to shift the eyes back and forth. If I'm feeling symptoms from that, same rule, I need to take a break. If the symptoms don't settle down within 5 to 15 minutes, we're going to stop and come back to it another day. But that's saccades. The other one is smooth pursuit or a tracking exercise. You can do this on your own simply by taking a pen or pencil. Don't move your head. Follow the pencil. You can do little circles on each side, or you can cross over and do big boxes. But usually I go a box on the left and on the right, moving around. You can do H motions, following it up and down, and then go to the other side, up and down, H motions. You can do vertical without moving your head, doing vertical inline and vertical lower inline. So that's smooth pursuit and saccades. The other thing is there is other resources online, and I'm going to make a plug for Optokinetics. There are some smooth pursuit and saccades where they put a screen on where you can watch the ball bouncing around on the screen, which is really effective. Online you'll probably find other sources. And then there's also optokinetic training, which seems to be gaining in the literature and gaining in use. But it's where you are looking at, for example, a fixed point, and there's different movements around you. So it's another way of working that balance and working the eye training as well. You can always Google optokinetic training, and there's multiple resources out there for that as well. But this should be enough to start with for balance and ear training. Okay, I want to thank everyone for participating today, everyone for looking at this. If you have any comments, please, I invite all constructive, positive, and constructive feedback. And if you're not sure about things, feel free to contact myself or your own local physical therapist or physiotherapist and or your physician. Remember, if you have significant balance issues, it needs to be addressed and looked at. And you should be under the care of a medical team, including physio and physicians. Thanks very much. Bye-bye.